Hi, my name is Dr. Cody Koch, and I'm one of the plastic surgeons at Koch Carlisle Plastic Surgery. And today, what I want to cover is I get asked more and more about what a deep plane facelift is versus an SLift versus a Smas lift, and there's many different names for lifts. Here at our practice, we've been known for the SLift, and initially that was known as a short incision facelift. But over the years, people have come to ask for an SLift, and that's come to just be customized for the patient. So in some cases, an SLift is a deep plane facelift or a deep plane neck lift, and in other cases, it doesn't have to be that aggressive. And some of the differences are the length of time for healing and swelling, and for deep plane facelifts, that obviously takes longer with 2 to 4 weeks of swelling, whereas an SLift has about a week to 2 weeks of swelling, and an SLift meaning, in that case, a less invasive lift. Now, our patient today, Ashley, doesn't have very much laxity. She has a little laxity under her chin that bothers her. And so for her, we won't be doing the full deep plane facelift, and I'll talk a little bit later about what true deep plane facelift is. And I think more people out there claim to do deep plane facelift than actually do, because it involves cutting and releasing the ligaments of the face and resuspending the entire face, even out to the nasolabial folds, as opposed to just lifting up a Smas layer a little bit and pulling it back. And Ashley's main concern is a little laxity under the neck, and some of this is skin, and some of it's actually a muscle called the platysma muscle. And so herein lies the difference of what a deep plane neck lift versus a deep plane facelift is, and often the two are combined, and frequently those are combined in what I do. And almost in every case I do a deep plane neck lift, because what I think is important is I make an incision here, and I first, in some cases, do liposuction to remove little bits of fatty tissue, but she has very little fatty tissue in her neck. But more importantly, what I do is I lift this skin off of the platysma muscle, and those muscles typically do not come together in the midline. And I separate those muscles and I go under those muscles. And in some cases, people will have very prominent muscles called the digastric muscles, which I'll resect, or they'll have a submandibular gland that hangs low under the jawline, which I'll resect. She doesn't need either one of those. But what I will do, even in her case, because it gives more of a snatched jawline and also a longer life for the lift, is I will, after going under those platysma muscles, I will sew those together like a corset under the chin, and that starts the tightening. But then the majority of the tightening is going to come, I'm going to have her turn her face to the left, is going to come from an incision around the ear, behind the cartilage pointer, and then back behind the ear into the hairline. And from there, I'm going to go under the skin just a little ways. However, I don't want to just pull skin back, because skin stretches over time and your results don't last very long. So the important part of what I'm going to do is I'm going to go under the Smas layer. Now, some surgeons will go under the Smas layer back here under the zygoma, and that's fine, but you're going to get a better lift if you go out further in front of the face. And what I've drawn here is the natural progression of going under that Smas layer in a deep plane facelift. Now, this little circle is where the majority of those zygomaticocutaneous ligaments, or the ligaments that hold the face in place, are at. And the reason many surgeons don't like to go through those and release those is there are some important nerves there. But if you've worked around those nerves for a long time, you know how to do that safely. And so in a true deep plane facelift, you're going to go under the skin and the malar fat pad in the pre-zygomatic space, and you're going to go under the skin and Smas layer in the pre-masseteric space, and then you're held up right here. And so you want to release those zygomaticocutaneous ligaments. It's not just in this little patch, also known as McGregor's patch, but they course down towards the corner of the mouth as well. So you're releasing them all the way down there. And so the more facelifts, the more lifts you do, the more comfortable you are releasing those ligaments. And so in the right person, you get a better lift. Now, in a deep plane facelift, someone that needs more lift in through here, that's what you want to do. In Ashley's case, she has minimal laxity, and so we don't need to release that ligament. We don't need to go up here. Her main concern is her jawline and a little bit of laxity in her neck. So we won't be doing a true deep plane facelift for her today, but I will be going out under the Smas and over the masseter muscles in that pre-masseteric space, all the way down through here. to give her the best possible lift along her jawline and then through her neck. Now that also extends down under the platysma muscle. As you remember, I went under the platysma muscle here, but I also go under the platysma muscle from this aspect because it's rigidly adherent to the sternocleidomastoid muscle here, which we want to release because it's not rigidly adherent in this area. So if I'm out in this area, I get more movement of the skin and the muscle and more control there. And so that gives you an idea of some differences between the types of facelift. Again, an SLift for our practice has just become what we've been known for in the past, but it's a customizable lift, and oftentimes I'm doing portions or a full deep plane facelift in the course of what an SLift would be. Oftentimes we'll do that here in the office with Valium and some nitrous oxide to make people comfortable. However, you can do it under general anesthesia at the surgery center as well. When I'm resecting the digastric muscles or the submandibular glands, that always has to be done in the surgery center in order to make people comfortable. But the rest of it can oftentimes be done in the office. But I always ask people to be realistic with themselves on how they would feel most comfortable. So that just gives you a little background of what we're going to do today, and we'll talk a little bit more later about how things are progressing. Thank you.